Welcome to Sugar River Family Practice. I'm your host, Elizabeth DeRazio, and we're joined by the owner and founder of this unique facility, Dr. Gordon Black.
Hello, thank you.
Thank you very much for joining us, Dr. Black. And this really is a unique approach to healthcare in this area. Tell us about how you started this practice and why it's really got a unique message.
Well, I originally started as a small walk-in clinic across on Opera House Square and found that we had very few primary care providers in the area. Some were leaving, so I decided to turn that into a family practice, but I didn't want to be a typical kind of in and out factory-type medicine. So I decided to make a clinic with longer appointments, more personalized care. I'm not affiliated with any other hospital in the area, but I do work closely with a lot of the hospitals and providers to give kind of a unique, hands-on and patient-friendly experience.
I think that's something that we've all felt when we go to the doctor, especially during cold and flu season or something like that. You see the waiting room is full and you're like, great, I got 10 minutes max with this person. But you really want to specialize in having a full time with your clients, giving them the longest time they need so they can discuss things.
Exactly. Though they call me Dr. Black, I am a board-certified family nurse practitioner with a doctorate. But one of the main tenets of being a nurse practitioner is holistic care, looking at the entire patient, looking at the patient's family, and not just the problem that they're in front of you for today. And really to focus on prevention, trying to make sure that people are healthy in future so that we're not trying to cure, which is very expensive, but we're trying to prevent, which is much easier to do. And
I think we as Americans have really gotten into the habit of treating symptoms.
Yes.
I've got a headache, quick take a Tylenol. You know, we haven't thought of what's causing that.
Exactly.
But really looking at an approach where we look at the causes of illnesses leads to health instead of just putting a Band-Aid on something that really needs something more effective.
Exactly. Sometimes it's a matter of just lifestyle changes. I can help with weight loss, I can help with smoking cessation, just exercising, just general education. And my patients tend to really enjoy having that extra time. The average appointment is about a half hour. Just to have that extra time to sit and talk and ask questions and just to have a conversation with people. I really don't want patients to feel that they're being rushed out the door. I really do think people like that. Someone mentioned to me that it's a new concept. It's actually more of an old concept. Coming back is what it is. So.
And it's funny because we read in all the novels of the doctor with the bag coming to the house and spending time with you and getting to know your family and things like that, or going to the practice that your grandfather went to and your aunt went to. And because, you know, the nurses and doctors knew you, they could say, this is where this is coming from. So you're really trying to revert to that original model.
Yes, and it's very receptive. People are very receptive to that. They really like that extra time.
If someone were thinking of perhaps transferring to your practice, what would you recommend they do?
A couple of things. They can call us directly here at the office. Our reception staff will send out a new patient packet. They can visit our website where they can download a patient packet. And pretty simple process. We get your records, review them, make sure that we can give you the appropriate care you need. Meet with you, make sure that we're someone that you want to work with, and you're set.
In an age right now where the healthcare market is changing so drastically, what is a piece of advice you would advise someone about taking control of their own healthcare?
Probably the biggest thing you can do is just get a primary care. Whether it's me, whether it's someone else in town or in the area, just get a primary care. Everything you do in your life can then be coordinated so that we know you're being healthy, that you're getting your vaccinations, you're having your screenings, things of that nature. So really, just get a primary care. It doesn't have to be me, just get a primary care.
And I understand that if you have lab results, you'll even call your clients back personally.
I tend to, yes. I often have to warn my patients that if I call you, don't be afraid. I've actually had people say, oh, there must be something wrong. And no, I just enjoy having those conversations, so I often will call.
That sounds like the original wonderful service from a good family practice. So thank you for joining us, Dr. Black.
Thank you.
And if you're looking for a more patient-centered approach from a family practice right here in the heart of the Claremont area, come and meet Dr. Black and the rest of his practice.